Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So what is the role of immunotherapy for unresectable stage 3 non-small cell lung cancer? So right now, the standard is to offer our patients with stage 3 unresectable disease who've completed definitive concurrent chemoradiation the option of consolidation therapy with durvalumab, which is an anti-PD-L1 antibody given IV every 2 weeks for 1 year. This is based upon the Pacific trial, which was a phase 3 international trial involving specifically patients with stage 3 unresectable non-small cell lung cancer, provided that these patients did not have evidence of disease progression after definitive platinum-based chemoradiotherapy. They were randomized to receive either durvalumab or placebo. This was done within 1 to 42 days after completion of chemoradiation in this trial. And what this trial showed was that those patients who received the durvalumab did better with regard to progression-free survival compared to those patients receiving the placebo. The safety profile in our patients receiving the durvalumab was also favorable. There were no new safety signals seen. Many of us worry about the possibility of pneumonitis, especially in those patients who've received radiation as part of their treatment. And there is concern that immunotherapy can also increase the rate of pneumonitis due to the possibility of patients developing autoimmune pneumonitis. But encouragingly, this trial did not show a significant increase in the rates of pneumonitis. The time to death or distant metastases also favored those patients receiving the durvalumab. And when they did a subgroup analysis, the investigators for the Pacific trial found that patients benefited with the addition of durvalumab regardless of their degree of PD-L1 expression. So even those patients who had less than 25% PD-L1 were found to benefit with the durvalumab. So it was based upon this data that the FDA did approve durvalumab as consolidation treatment after completion of chemoradiation in our patients with unresectable stage 3 disease in February 2018.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly, Novartis, Takeda, AstraZeneca, and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate and visit us for more information at cancergrace.org. Thank you for listening.